Hello, lovely people. Today we are going to discuss case 48, and we have to focus on that there is a big relation between case 47 and 48, and I'm going to discuss in my next video the main correlation between both cases. So case 48, which is an endodontic problem, it's a kind of endodontic failure where the patient asked to have a solution for it. The chief complaint was intermittent pain on biting, and the patient mentioned that the tooth was previously treated. And she also mentioned that the coronal restoration was lost 4 months ago, which means we have lost the coronal seal, which will complicate more the case. And also, she knows that there is a separated instrument inside the tooth. And this may highlight that the pain which the patient is suffering from since finishing her endodontic treatment is related to the separated instrument. She had made this tooth 2 years ago, and again the coronal part or coronal restoration was lost 4 months ago. So today we are trying to focus not only on the hard tooth structure, we are going to focus on the whole surrounding periapical tissue, soft tissue and hard tissue. So we need a full detailed intraoral examination, including palpation and trying to find if there is any kind of sinus or infection. And we have to do a very good periapical x-ray and to be able to make a full detailed interpretation for the x-ray. So yeah, we did 2 periapical x-rays using parallax technique in order to be able to track the 3 canals, and we could see clearly the separated instrument in the mesially shift x-ray, periapical x-ray, and it was somehow coronal and loose, which makes it an easy case to be retreated. After we did the x-ray and we could locate the separated instrument, we then try to find how can we remove a separate instrument and how can we evaluate how difficult is the case. To evaluate how difficult is the case to remove any separated instrument, we have to see how deep is it. If it is so apical, it will be really difficult to be removed, and if it is rigid and big, it will be difficult to be removed. Also, the morphology of the canal, if it is a straight canal, it will be so easy to remove it. However, if it is just a spiral canal or a tortuous canal, it will be so difficult to remove it. Also, if it is a stainless steel instrument, usually it is more easy to remove it. But first, before I have to remove the old separate instrument, I have to be able to prevent further fracture of any instrument. In the old days, we used to use any endodontic instrument several times, but nowadays we are trying to keep it just as a single-use instrument, which really decreased the incidence of separate instrument. And also we may use coronal preparation, chronoapical, in order to be to avoid more stress on the instrument, and we try to use flexi instrument, not rigid ones, and keep sequential preparation of the root canal in order to avoid any fracture. Also, we have to keep the irrigation, good and vigorous irrigation, to avoid any clogging of the canal. Additionally, we have to be able to discuss, if we are not able to remove the instrument, what are the other options for this patient. Either we can make a full bypass of the instrument, or just try to make a vigorous sodium hypochlorite irrigation in order to remove as much as bacteria as we can. And then we do a very good coronal seal. Hopefully that there is no more extra infection. However, if the infection is still exists and it is so resistant, so it may be that our only option is just extraction, and we have to be so clear with our patient before beginning our retreatment in order to make her able to take whatever decision she wants. However, this case was lucky, and the instrument was removed, and then a full root canal obturation was done with a gold crown. And we tried to make a gold crown in order to be able to make a very good coronal seal, as we don't need any kind of further coronal leakage to avoid reinfection. The case is so easy and straightforward. However, it's in this case they tried, our Odell book focused that we have to make a comparison between case 47 and 48, and that's what we are going to do in our next video. See you and bye bye.